It might not look like it, but this toddler is having her spine adjusted. Karen Smith is a chiropractor who specializes in pediatric care, treating babies as young as a day old. She says a child's first experience in the world can often be traumatic, and the care of a chiropractor can be beneficial in the early stages of life.
A lot of babies will have issues when they're inside the mother's belly or when they're coming out, or as well when babies are in car seats for long periods of time, bouncy seats for long periods of time, exercisers, things like that can all basically make the spine not work efficiently.
Most of Smith's youngest patients are brought to her because of problems with nursing.
They can't properly breastfeed if they can't turn their head properly and open their mouth properly to latch. They also might have some sort of suck dysfunction as well that might be going on, so a chiropractor can assess that.
Sarah Kelly first brought her son Van to see Smith when he was only 7 days old and having trouble latching. She noticed a difference almost immediately.
Within a couple of visits, he was opening his mouth and latching perfectly.
Other common conditions that bring babies to Smith's office are ear infections, colic, constipation, and acid reflux. She stresses she doesn't treat the symptoms, but the mechanical issues in the spine.
With ear infections, I don't treat the infection in the ear. I treat the neck, and I treat the nerves in the neck, the spine, the joints, and the muscles, and that can allow things to drain more efficiently and therefore can help potentially with ear infection.
Smith admits people are often skeptical and associate chiropractic care with a heavy, forceful touch. She says that's not the case with babies. Little people get little adjustments.
We use the same pressure as basically when you feel the ripeness of a tomato. Each adjustment is based on basically the age of the child, the size of the child, the structural development of the child, flexibility of the child, and patient preference.
Kelly credits her own experience at the chiropractor and a detailed explanation ahead of time with putting her at ease. Now, at 4 months old, Van gets adjusted according to major developmental milestones.
So when he starts rolling over and sitting up, and when he was holding his head up, I brought him as well.
So we would like to check their neck at that point. If they're sitting up on their own now, we like to check their back.
Kelly plans to continue with chiropractic care for Van and recommends it to others.
And I really credit it with being able to nurse him because he wouldn't open his mouth wide enough to latch on. So for other people who are having problems that may not know why, it definitely is something to try at least.
Well-adjusted advice for parents who are looking for a different approach.
I think he may have done the left one time, but the right is